Greetings everyone, my name is Justin Benton and welcome to this video on how accreditation improves quality and safety in healthcare. Have you ever heard on the radio an accredited chest pain center, or ever went to a doctor's office and seen a sign that says we're accredited by so-and-so? Well, let's dive into what accreditation means, some examples of places that were not accredited, improves quality and safety, and lastly some specifics of the accreditation programs. Accreditation is a voluntary process. In this voluntary process, the hospital or other type of organization pays an outside company to come and review its own policies and procedures to determine if it meets the standards of the accrediting body. In order to maintain accreditation, a facility must continuously meet and uphold the standards. If the standards are not being met, the organization must prove that remedial action has been taken and the organization is concurrent to the standards of the accrediting organization. A couple of examples of accrediting bodies that you may have heard of are the Accredited Association for Ambulatory Healthcare, AAHC, National Committee for Quality Assurance, the International Organizational for Standards, ISO, or Intrasocietal Accreditation Commission. A more widely known example is the Joint Commission, TJC. While these organizations might bring fear when the word comes around that someone is coming to do an inspection, these accrediting bodies are only wanting to make sure that your organizations are still conducting business that meets their higher standards. Accreditation can be a competitive edge in the global market we live in, and can benefit patients by ensuring that they are receiving high quality services. HT Digital Content Services 2018. Becoming accredited can help an organization move towards a total quality management approach. Let me talk about some examples of when the quality ball was dropped. A hospital in Louisiana had reused its equipment during procedures that was not properly decontaminated. The contaminated equipment exposed over 300 patients to HIV, hepatitis B, or hepatitis C. Another failure of quality standards was a hospital near Pittsburgh that had over 100 patients receive percutaneous coronary intervention unnecessarily. Case Western Reserve University School of Law, 2012. While those are some specific examples, one study showed that at non-accredited facilities, slightly over 50% of the patients had an overestimation of the narrowing of the carotid arteries. Alkahine and Shaw, 2011. These examples are something that could have been solved by having an accredited organization review the current policies and procedures to see where the gaps or failures are and correct it. How does being an accredited facility improve quality? In a literature review, Impact of Accreditation on the Quality of Healthcare Services, a systematic review of the literature, discusses multiple studies that show accreditation increases the quality and patient safety in comparison to non-accredited facilities. Prospective analysis in the U.S. of approximately 88,000 patients at 24 accredited trauma centers had better outcomes with certain type of trauma injuries. Alkahine and Shaw, 2011. Another retrospective study of around 4,100 U.S. hospitals reported that the accredited Society of Chest Pain Center hospitals had approximately a 12% increase in percutaneous coronary intervention. Also, the non-accredited hospitals had a vastly lower compliance with the core measures of acute myocardial infarction compared to the accredited hospitals. Alkahine and Shaw, 2011. If the organization thinks of the accrediting body as an external customer in the total quality approach, Gowitz and Davids, 2016, page 7, the organization can easily meet the quality necessary to meet the demands of the accrediting body. How does being accredited by the Joint Commission improve quality? The Joint Commission establishes and continuously updates guidelines that are evidence-based to provide a better quality and safety for patients. Case Western Reserve University School of Law, 2012. Improves quality by focusing on the quality management side of the products. Goich and Davids, 2016, page 225. The ISO 9000 accreditation includes almost all the aspects of manufacturing process from the raw materials to the customer's hands. In this video, I have talked about what accreditation is, what can happen without being accredited, and what can happen with being accredited, and given some specifics on some of the certain accreditation programs. Thank you for listening to this video on how accreditation improves quality and patient safety.